All right. So we're going to start with, one second. So we're going to start with this presentation. So we're going to learn about the mastering the posture, understand, assess, and correct. Just to give you some introduction about myself, I'm Dr. Sanket. I'm a physical therapist at Shorter Physical Therapist and Therapy, and I've been therapist for almost 18 years and been doing this for a long time. And now we address a lot of different issues, but posture is one of my favorite ones because it's a base of everything. Because if a lot of patient who comes with the back pain, neck pain, hip pain, knee pain, I tell them, fix your posture and you can fix your issue. So let's dip into it. This is what we're gonna cover. We're gonna go in deeper about like how you can design your own exercise. I'll be trying to focus a little bit more on that area so you know how to do that. But we'll be covering what is posture, the different postural type, postural self-assessment. I will have some questionnaire so you can fill out. I would love to be more interactive. So you can ask me a question or you can type in the chat box, but I would love to get more feedback, more questions so I can address more issues, okay? Why posture is important, what to consider when designing your own exercise, when to seek professional help, and our approach that how we do the things. So a lot of people knows nowadays, like, it's not anymore like, that, okay, no, this is new information. A lot of people are aware of this posture, okay? So the first one, as you can see, is a sway back, means your back is kind of going forward. This is lumbar lordosis. Lumbar is a vertebra on the lower back, that increase your curvature. Lordosis means like, that curvature. We have a normal curvature, but here it increased. Thoracic kyphosis, that means humpback, you can say. Forward head, this is a lot I see lately since the phone, since the COVID. I see a lot of things, and this is a good posture. So let's talk about types of posture. So as you can see, like forward head posture, kyphotic, sway back, flat back, uneven shoulders, hips, and military posture. So it's a kind of a little variation of all those different postures. So let's go into it, like, how we can fix all those things. The most important part about the posture is understanding your own posture, understanding that do I have an issue or not, understanding that do I need to work on certain muscles or not. I always give the example that if you search on the Google that I need to strengthen my pectoralis muscles, there are thousands of exercises that you will find out. But I'm the one that after the assessing, I'll be able to tell you that, hey, you need to address your pectoralis. That's my job as a physical therapist I'm talking about, that we guide you to make sure that is done. And by assessing yourself, if you can tell that, okay, these muscles are tight and these muscles are not, you can design your own exercise as well. Okay, so this is the first thing that we have, is the postural self-assessment quiz. There are 7 questions. I want you to look at the question. I'll give you about 2-3 minutes to read it, and then I'm going to go on the next. If you want me to come back to this, let me know. But it's very simple. You read the question, and there is a response from 1 and 2. So you score yourself. You select the answer 1, you just put down 1. If you select the answer 2, you put down 2, and you're gonna add at the later on in the slides after the questions. So just read the question. I'm just gonna give 1 more minute. There are 3 questions here. Just write down your score somewhere or remember your score, and I'm gonna show you the significance of that. So first one is a standing posture. So typically how you stand. What do you like? I tend to lean more on one leg or shift my weight on one side than standing, and my shoulder often hunch back. That's 2. Or you just stand properly. So just read that, answer those questions. Okay. All right, I'm gonna move to this one. If anybody wants me to go back to that screen, do let me know. I'll give about 2-3 minutes here, read the questions, and then we're gonna go on the scoring side. Can I read it still? Okay. Shoulder alignment. Number one, my shoulders are generally level and relaxed without one shoulder noticeably higher than the other. I think if I don't say it, that would be better. So in that way, you can read and you can think and answer it. All right. So once you finish these questions, if you guys can just write your number, okay? So most like it's from 7 to 14, okay? So just write your number in the text, like in the chat box. Okay? So now, if you got your score, you will see here that we score from 7 to 10, 11 to 14, and 15 to 18. So now, if you fall under 7 to 10, that means your posture appears to be generally good with few significant issues detected. Keep up the good work. That means like, you're okay, you don't have much issue, you're good. 11 to 14 point, that means you may have some areas of concern regarding your posture and alignment. Considering implementing strategies to improve your posture and seek professional guidance if needed. Okay. So most of the time, 11 to 14, you can do your own exercise and you're okay, no problem. 15 to 18 is the one that we are a little bit more concerned, means that can lead to more health issues, more musculoskeletal condition problems, back pain, neck pain. So if you fall under 15 and 18, then you really want to pay attention to that. Okay. All right. How proper posture impact overall health? So when your posture is good, that really helps you to maintain your overall function of the body. So most of the musculoskeletal injuries happen because of the poor posture. I always give the example like, when one side is tighter than the other, the tighter side of the body is going to pull, okay? And that does affect your performance, okay? So, and then when you pull on the other side, the chances of injury on those side increase, okay? Also, it reduces the pain. So when you're straight, when you're not putting the strain on your back, that does help you with your pain. Just to give you example, this is a real example. Let's say you have a lumbar lordosis. That means your lower back curvature is a little bit higher than normal. Now, when you have a normal curvature, it's straight, no issue, no pressure. But when you have an increased curvature, every time you're trying to walk more, you're increasing the pressure by 25% on your lower back. Think about throughout the day when you're putting that pressure, extra pressure on your back. No wonder at the end of the day, or like, when you're standing too long, you're going to start feeling achy or pain on your lower back. It does enhance your physical performance. So when you have a good posture, you can perform well, you can run well, you can do a lot of activities with the good, like, posture, like golfing. You can do golf better if you have a good posture. But if you have one side shorter than the other, or like your head is tilting, or maybe your shoulder is not aligned, or your hip are not aligned, it's going to affect your performance. Also, it improves your breathing and lung capacity, your lung function. Because when you have a poor posture, let's talk about like hypotic, your hunchback. When you're hunchback, your lung does not have room to expand properly. So that does affect your breathing. People, I know that when they have too much hyposis, too much humpback, they cannot breathe fully. That does affect their performance as well. All right, so signs of the poor posture. So signs of the poor posture: rounded shoulder. I'm going to talk a little bit about like, those things. So I'm going to demo all those things. So rounded shoulder, tilted head tilted, bend knee, back and neck pain, headache, and fatigue. So Okay, for a minute, I'm going to stop sharing so I can kind of go over it. Okay, so when I talk about like rounded shoulder, so when you stand tall, so your thumb should be facing forward like this, okay? When you're standing in front of the mirror and if it's like this, that means you have rounded shoulder. How it impact is, think you can do it yourself, keep it straight, and then you go straight up, your shoulder is fine. You won't feel much pain or discomfort. Same thing, when you turn your hand and trying to go up, you will feel some kind of tightness in your shoulder. So think about it, if somebody is doing the job, overhead movement, repeated overhead movement, and if their posture is like this, high chances they're going to end up with a shoulder impingement injury, high chances they're going to end up with shoulder pain. Because when your posture is like all the time, and if you're doing repeated movement, that's where you're injuring your shoulder, okay? So it should be more like this, thumb should be facing forward, okay? Now, tilted head. Many times we've seen people like, they're like this. And many times the phone, right? We have a habit, okay? So that leads to tightness in this side. And then over the time, at the end, they said, oh, my trapezius, my neck is feeling so stiff, okay? So that does affect. Sometimes if you have like issue with your leg, poor posture, tightness in certain muscles, your knee doesn't lock. We need to lock our knee. If you don't lock the knee, all the pressure goes on ligaments. When it goes on your ligament, you got high chances of injury. So I'll give you one example. I did shadow one of the knee replacement surgery, and I was talking with the surgeon, and we discussed. He had we asked had a conversation that how many success stories for the knee replacement. So 80% of the people get better. 20% there is an issue. So we can why, what happened to those 20 people who did the surgery, but they have issues still. So the answer was they never get that knee extension, the total locking. So when that happened, that lacks of the range, that put a lot of pressure on the ligaments. And then over the period of time, that wears off. So we got a problem after that. So that is the reason that it's very important you pay attention to your posture. All right, let's share the screen again. Okay. So those are the signs of the poor posture. When you see all those signs, something you need to address. Now, I'm sorry, one more time, I'm going to show you all these tests. Now, these are the postural self-assessment tests. You can do all those tests to find out whether you have issue or not. Okay. So I'm going to stop sharing one more time, and I'm going to demo all this test. Okay. Okay, so the first one is a mirror test. The mirror test is simple. Okay, so what you're going to do is just stand tall, okay, in front of the mirror. Okay, and then just look in the mirror and observe. How's your head? Is it tilting? Is it straight? Then look at the shoulder level. How's your shoulder? Is it level or is it tilted? Okay, how's your hip level? Is it aligned? Usually it's good if you do it in minimum clothing so you can see exact landmark, but making sure the hip line is straight, making sure your knee are straight, making sure your ankle is facing forward, not turn or like that. Then you go on the sideline and then observe the same thing, making sure that it's aligned, your shoulder tip, your hip is aligned, not like this. I'll show you the picture of good and bad posture, but when you're like this, making sure your knees are aligned. And then for back, you have to ask somebody to look from the back and say, check the whole level as well. One test is the second test is a wall test. This test is also very simple. What you do is you stand against the wall, okay? So I'm gonna show you here. So you stand against the wall, your hip area, your butt area, you're just making sure you're touching that on the wall, and you just stand. Don't put any kind of pressure or effort. You just stand nice, your heel and your butt area, you're just touching the wall. And then your back and your neck should not be far from 2 to 3 fingers. Okay. If it's far more than 2 to 3 fingers, that means that you have a poor posture. So that's the wall test. Okay. Okay. So the other one is the Adams test. So the Adams test is for your scoliosis, because many times people have that S curve, C curve. There's a scoliosis in your back. So many times it's structural, or like, or it could be functional. So what we need to do is lean forward, and what we do is level up your scapula. So we just lean forward and just making sure that level of your scapula is even. If you see a little bit tilted, that means there are chances that your spine is curving. Okay, that's the Adams test. The other one is the neck flexion endurance test. This is very important for your like headache, neck pain. Okay, your deep neck flexor muscles, make sure those are good and strong enough. The way you do that is you lay down, then you do chin tuck and lift your head up. You need to make sure that chin tuck is maintained, and then lift your head up. You have to maintain that position and count how long you can hold it. If you're not able to do the chin tuck, that's a fail. That's a negative test. You cannot hold it higher, lift it up, that's negative. For female, if you can do more than 25 seconds, great. For male, if you can do more than 30 seconds, great. That means you have a good neck flexor strength. But if you cannot maintain position, or if you cannot keep the chin tuck, that means your deep neck flexors are not working well. You need to work on that one then. Forward flexion. This is my favorite one. I do this all the time when I assess the patient. So let me get one stick and I'll show you what is forward flexion test. And you guys can stand up and do it with me. If you have a stick, or even don't have a stick, you can get up. And I'm going to show you first. I'm not going to tell you anything. Just lean forward, and then I'm going to show you what I'm looking for. Let me get the stick. 1 second. All right, so what we're looking for is anytime when I get the patient with the back pain or mid back pain, I do this test. I tell them simply, just lean forward, okay? And I don't tell them anything. I just say, just lean forward. Many times you just go like this, okay? Now, when you're leaning forward, this stick, see, it's touching my sacrum, my lower back, and I'm touching my neck. When I lean forward, everything is touching. Nothing is off. Everything is touching the stick. If you're not able to do this, you got an issue with your neck. If it's like this, then you're bending your sacrum, okay? Your lower back. So you need to make sure when you do the forward test, forward lean test, everything has to be straight, okay? So if you're not able to do this, I want you to practice every day in the morning to practice this, because think about it, throughout the day you do lean forward, you do pick up a lot of things. When you're doing that, and if your posture is not good, you're adding a strain to your back, to your neck, to your mid back. And that is the reason that what happened is many times we're trying to lift something and you get the spasm in the back because you're not following the posture. If you practice this every morning, just look at the mirror when you're doing brushing and just making sure you're leaning forward with the straight back, upper back, and neck. That can really make a big difference, okay? The last one is a scapulohumeral rhythm. So when we move our shoulder like this, our scapula moves, okay? So every degree that we move our shoulder, our scapula, your shoulder blade moves along with that, okay? So what we do is many times when patient comes with the mid back pain, this is what I do. I just take the cheat sheet up, and then I just observe from the back, and I just do this way. I ask them to just go up and down, And what I do is I observe how the scapula is moving. If I see that the scapula is not moving properly, we got a problem. If I see that one scapula is moving more than the other side scapula is tight. So that's how we know whether that is moving in a synchronization or not. So we need to make sure you observe that. So I'm going to share the screen again, but these are all the tests that we covered: mirror test, wall test, Adams test, neck flexion endurance test, forward bending test, and the scapulohumeral rhythm. All right, let's get back to the slides. Okay, so what to consider when designing your exercise. So when you're designing your own exercise, what do you need to consider? So one is targeted approach. So once, as I said, you need to know what muscles are tight, what muscles are not. The way you can tell is, let's say if you have a humpback, okay, your kyphotic, your thoracic is kind of like this way. We can go more detail into that, but by doing this, we can tell that all the front muscles are shortened, all the upper back muscles are lengthened. So in here, we can work with the strengthening of your rhomboid, your upper back muscles, okay? And then we can stretch your pectoralis to make sure it open up. Let's say you have a rounded shoulder, okay? So that tells me your pectoralis major and minor is tight because it pulls your shoulder in, okay? So you need to find out where your need is. So that targeted approach really helps, okay? Individualized progression. Everybody is different, okay? Everybody's tolerance is different. Now, when you design your exercise, you need to understand your reps and sets. Let's say you're doing one exercise where you're trying to strengthen your upper back, you're using a resistant band and you're just pulling it back and forward. Now, don't just do 30-second, 40-second. You need to feel the muscles. When you do the reps, when you do the minutes, when you do the seconds, you need to make sure by the time you finish your set, you need to feel it. You should be like, okay, you know what? I need to take a little break. That's called the loading, okay? You need to address at least that much strength, then only you're gonna see the results. If you're just doing, okay, somebody told me to do 10 times, I'm just gonna do 10 times and leave it, not gonna help you. You do for a month. This is what I give the example. If I take the dumbbell, 2-pound dumbbell, if I do my bicep curl, okay, I do maybe 5 times, 2 pound, okay? And then after a month, I don't see any results in my biceps. I won't, because that's not enough loading there, because I need to check my capacity. And by the time there are more to it, but the simple way you can tell yourself is by the time you're doing 10 repetition or 12 repetition or even 30-second or a minute, by the time you get a little tired that, okay, now I need to take a break, my muscles are fatigued, that's the right amount. In the beginning, you can start maybe 80 percentile of that. That means that the rate of perceived exertion, instead of okay, I'm done, I'm so fatigued, you leave a little bit room for that fatigueness. So maybe you do 2 less rep than that, okay? Or maybe you can do 10 less seconds than that. So that's how you decide your exercise, okay? Functional relevant. So what you do, are you a desk worker? Are you working on the floor? Are you standing too long? Does your job require too much forward bending? Does you require too much lifting? Based on that, you have to address your exercise as well, okay? Long-term sustainability. You have to make sure your program is designed in a way that address your goals, your preference. It has to be based on your lifestyle. So keep in mind that you need to do this for a long period of time. So don't just do it for a short time. Just get in the habit of getting in good postural training so you can see the results better, okay? All right, key factors to consider. As I mentioned about the muscle strength, you got to address the muscles and you got to understand about the reps and sets and those kind of things. Flexibility, that is more like a stretching. So let's say you have a tight hamstring or tight pectoralis. Now, longer you hold it, better it is. Always, like I did the workshop last month about the stretching. So I did explain about the different types of stretching, different factors on stretching. Every month we come up with different topics. I think next month we're going to do ergonomics. So yeah, if anybody interested, just send us an email or text us and we will enroll you in that as well. So the flexibility is if you stretch your muscles more than 25 seconds, then only you can make some changes to your muscles. If you're just stretching for 10 seconds, you're not doing anything. You're just warming your muscles, okay? If you want some structural changes, you want to make sure you improve your length of the muscles, you need to hold more than 25 seconds. Okay. If you stretch your muscles every day, over the time of month, about 4 weeks, you can lengthen the muscle by 1 centimeter. Okay. All right. Motor control and movement pattern. It's very important that we address this issue. The proprioception training, the coordination exercise, the motor control when you're doing the exercise, those really helps you to improve your posture, because working with one muscle versus when you're addressing the whole motor movement pattern makes a big difference in the exercise. So what I mean by that is, if you just do bicep curl versus you do push-ups, push-ups is much better results versus bicep curl. Okay, because bicep curls, when you do bicep curl, you're just addressing one muscle group. When you do push-ups, at that time you're addressing multiple muscles, so that helps more. Okay, so now we're going to go a little bit more interactive. I'm going to show you some pictures and all, but underactive versus overactive muscles. So underactive means those muscles are not activating when we need it, and overactive means that muscles are working too much. And that is the one reason that always you feel in your trapezius, yeah, that's the muscle, like, I feel the knot. That is overactive muscles. It's very, very common that overactive muscles build up the nod. Overactive muscles build up the trigger points. Okay, so what do we do with the underactive muscles? What do we with the overactive muscle? So this is how you can decide your exercise. If there's a underactive muscles, then you strengthen the exercise. You do progressive overloading, means increasing your resistance. Focus on form and control. So motor control, making sure, like, you're using that muscle properly. That helps. Addressing the muscle imbalance. So which muscles are tight, which muscles are not tight, and you can address that way. If it's overactive muscles, you want to stretch, you want to do the myofascial release, then you can use the foam roller and trigger points. You can do postural awareness and correction, and you can do the address the contributing factor. So overactive muscles, if you stretch, that's the reason when you stretch your trapezius, it feels good. When you use the foam roller on the upper back, it feels good, because those overactive muscles, we need to calm them down. Now, these are some of the examples of the strength training. So let's say if someone has the issue with your poor muscles on your back. Okay, so one of the strength training is Superman. So just go on your stomach and just lift your hands and back on lower leg and just extend it and relax. Okay, and again, so this is the clear example. Let's say if one person might be able to do 10, other person might be able to do 30. Okay, so how do we improve? That's where that reps and sets and how you can decide your own exercise helps. Stretching. This is pectoralis. So you go in the doorway and you just stretch it and hold it long enough. Core stability. This is my favorite exercise, the dead bug exercise. The reason it's called dead bug is because when the bug goes upside down, they move their legs like that. That's the reason it's called dead bug exercise. So you're moving your hands and legs in coordination, opposite side. Okay. Here is the example of postural correction. When I see that someone has a forward head posture, we start with this exercise as well. So you're making sure your whole body is supported and you're doing the chin tuck and you're lifting your upper back up. All right, so lifestyle factors that impact the posture. So prolonged sitting. If you're sitting on a computer, you know how many people sit on computer nowadays. So prolonged sitting, poor ergonomic setup. Believe me, I have seen so many people, everybody knows that what kind of desk they need to do, okay? But nobody follows that, how they need to sit. They get busy, they get distracted, and then they forget, okay, what is it we're gonna do? They forget about it. So they have fancy chairs, standing desk, good computer distance, everything. But it's just their personal habit is the poor factor in that one. Repetitive movements, okay? Job required repetitive shelving. You're putting stuff away on the shelf over the time. Not good. Painters, screwdrivers, repeatedly using it. Those kind of things affect the posture. Now, when to seek professional intervention? Now, posture easily can be fixed if you address ahead of time. But if you get to the point where it's constantly you're getting pain in your back, neck, upper back, mid back, you need to make sure you address those ASAP. Restricted range of motion. When you feel that, okay, I can't, when I'm driving, I can't turn my head over the shoulder, we got a problem. worsening postural deviation. You see your upper back hump is just getting worse and worse and worse. You got to work on that one. Muscle weakness and imbalance. You start feeling fatigue. You start feeling that no, it's getting a lot of pain or trigger points like that. You got to see the doctor, like you see the physical therapist or somebody like that. Now, our approach. So what we do is that we do the remote or in-person software that we use to track the posture along with the objective assessment. We check the muscle length, we check the posture, we make sure like everything is correct, and based on that we design. So the reason I wanted to show this one is this is the report of the patient. Now you can see that when somebody is standing up like this, effective head weight is 21 pounds. Now typically when we stand up tall, normal weight of the head is around 10 pounds. But because of the poor posture, that is the real weight of that person. So that person's weight, the head weight, is 21.8 pounds. Think about the pressure you're putting on your neck with that kind of weight. Okay, so that does throw everything off. Okay, that does cause the upper back pain, that does cause the neck pain, that does cause the headache. Okay, so this is the posture. So think about the plumb line. Okay, so the green is a plumb line. So this is the anterior with front view. This is the lateral with side view. So you can see the front view looks great. Shoulders are aligned. The chest level is good. The hip level is kind of almost good. The ankle is good. Everything looks great. But when you go on the side view, you can see the hip is going forward. Okay, you can see the head is going forward. So that does affect the back and the neck pain both. And that can lead to the problem with the knee as well, because now all the center of gravity is going forward. Okay, and then we got a lot of pressure on the back of the knee as well right now. So when we do the squat analysis, so when the person is doing squat, we're using different muscles. So let me show you the next slide. As you can see, the knee is going out. The right knee is still going out, but compared to left, it's too much. So when we see the findings like right knee moves outward, left knee moves outward, right foot turns in all outward. So here the software tells me what muscles are overactive, what muscles are underactive, and then I do the objective assessment to really check what are those muscles that really affects, and then we can design the exercise. So here you can see if somebody's right knee moves out, there are possible injuries that patellar tendonitis, which is pain in your knee, right on the tendon, right on the center, ACL injury chances increased, IT band tendonitis, which is a pain on the outer side of the knee. So as you can see, possible injuries because of all this poor posture. All right, so these are the presentation. I'll try to keep it 30 minutes. I'm sorry if I went a little bit over. Any questions, I will answer it, but also we have offer as well. This is again, my job is to make sure you get education and everything, but if someone wants to, that's the reason we always put down some offer, so if they can get the benefit. This is very simple, the remote posture and assessment and 15-minute consultation with me or any of the therapists here. Normally we charge $100 for that remote monitoring and the assessment, but here we're just gonna do it for $25, and that is till Friday. You can call, text, email, anything till Friday, and you can claim this offer. But yes, it's very important that we address properly. If somebody has a pain, definitely you wanted to make sure that we address that. Stop sharing. All right. Any question for postural assessment or any personalized issue or anything?
Do you take 11-year-old kids also as part of this assessment?
Yeah, we can do that. We do, especially the young kids is good. The reason is because, you know, sports injuries. Because when we do the assessment, I do the single leg assessment, squat analysis, standing posture, sitting posture. We do the thorough assessment, and based on that, we can find out exactly where the issue is. Because I get a lot of kids who wants to play, but performance is affected because of their posture. So by doing the assessment, we can make sure that they're doing good. I had one recent, like I think 15-year-old kid who was a runner. And after running later in the day, he always getting some pain in the knee. So we did the assessment, and then he started doing exercise, and the results were great. So yeah, we can help definitely with the consent of the parents, of course. But yeah, we can definitely help the young kids too.
Okay, thank you.
All right. Any question? Anybody has any issue, pain? Any question about the presentation? I hope you like the presentation. I try to keep it more informative. I know, that a lot of information out there, but I try to keep it to more that how you can do yourself. Okay. And for that reason, that any question you have, personalized issue, pain, I would love to help it. We do offer free consultation as well in the clinics if you're nearby. In Texas, Carrollton, we can always see you in person. But this is the best offer, for postural assessment. So grab the opportunity. If nothing, just get your report. We give you all those slides that you saw. That was a real report. That was a real report of the patient. So it's worth it. Believe me, the information, the amount of information you get is really good. But yeah, I hope you learned, by this time you should be able to take a decision on your posture. Make sure those quiz that we did, you can answer those things, and the test that we discussed. We will post this video on YouTube as well, and you're going to get the link in your email as well, and you can refer back and you can watch it as well. All right, so if you guys don't have questions, so thank you for joining, and anytime, any information, just reach out to us. We do the workshop every third Wednesday every month. We come up with different topics, so if you have any suggestion, just give us a call. But next month, we're gonna do the ergonomics, okay? So I'll talk about how you can sleep, how you can sit, how you can set up the desk, everything. All right, guys, good night, bye.